professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee. I was going to describe the family health needs assessment in the form of a PowerPoint slide, but instead I decided to create this video because I believe at the community level, if you're being trained as a physician or any sort of health practitioner, or even if you are not necessarily at the ground level having interactions, but are trying to do more research into this, then this assessment tool is a good one to know about. And so this is contained within the World Health Organization manual, and so I felt like a video would do justice to this. So a picture of health for your family. So basically, physical health. Think about each member of your family. Write their names on the scale to show how healthy they are. Do you or does any of your family suffer from any illness or disability? Yes, no. If yes, what? And this could mean if you are potentially a caretaker or within the community, even thinking extending towards. Thinking about also in terms of those of you that are familiar with this, the social ecological model, the social ecological framework. And then just as we were talking, number two goes into social health. And so going into many things can affect your family's health. Do you have any worries with the following that you would like to share? And so then you go into a lot of the social determinants of health. This is where you're really looking into this. For instance, housing, finance, work or lack of it, relationships, women's health, men's health, exercise and leisure, food, smoking, alcohol, drugs, anything else. So a lot of these go into all of that. And is there a good support system? Do you have leisure? Do you feel like you can relax and enjoy? Of course, some of this has to do with emotional health as well. For instance, how do you feel? And then there's things affecting the way your family feels, and friends, work, unemployment, if it's unemployment, money, where you live. So, how do you feel about these areas? That might be different than what the actual circumstance is of the person. So, three areas that are being assessed here within this family needs assessment is the physical health, the social health, and then the emotional health. So, then there's actually a fourth one, which is really important to look at, and that is environmental health. And this is where you're looking for things like pollution, air pollution, um, of course, very important to overall physical health. In my personal research, actually established that connection. But noise pollution, the proximity to hazards, smells, maybe traffic, crime, firearm use, neighbors, home, things like that. How is the neighborhood? Parks, shops, are there places for fresh foods? Education, meeting places. How easy it is to get the health services that you need. For instance, clinics, general practitioners, pharmacists, things like that. And then the action plan accordingly. So, what are the needs? The action by family, and any action by the health visitor that needs to be done. So for this assessment tool to be used, it needs to be completed at a literacy level that the families are comfortable with. And if you're in a place where um, there may be multiple languages spoken, you want to be sure that you're speaking the language that is understood locally to administer this questionnaire. Um, and who completes it? Anyone in the family, or with the individual, whether it's a medical student or some healthcare practitioner. But this allows families to identify own needs, promote partnerships, participation, and equality between families and health visitors, and promotes and provides kind of a formal structure which allows family health concerns to be featured for public health. And so this creates assessment plans. A lot of this is with nursing, but really, this is shared between all different um, varieties of health practitioners. So, with medicine, and if you're going out into the community for the first time, these are some of the social needs that may need to be assessed in order to have complete notes, but also in order to conduct research within the community. Thank you for listening.